Hello everyone, I'm Eric, and today I'm going to introduce my research. First, let me introduce myself. I'm from high school affiliated to Renmin University of China, and today I'm going to introduce the project of design of the low-cost portable ventilator for third world regions. The background is under the pandemic of COVID-19. In the beginning of 2020, COVID-19 outbreak caused more than 80 million people infected, and about 2 million people died from it. Among all the patients who are affected by COVID-19, 1/6 of them requires ventilation treatment to help them breathe, but current ventilator could be very expensive. From this graph, we can see that in some countries in Africa, about millions of people have to share one ventilator, which is definitely not good for the control of pandemic. And there are three existing solutions. The first is the high-end ventilators. This is the kind of ventilator that's mostly used in hospitals. It is well-functioned, but it is really expensive. Well, the second is manual first aid airbag. This is totally different from the high-end ventilator. It has no function but prompting the air to patient's lung, and it requires manual operation. So it is inconvenient, although it is cheap. And the third is automated bag valve mask-based ventilator. It is a novel ventilator made by the researchers over the world. So these two graphs are from the MIT researchers. They developed this kind of ventilator based on the airbag and used the mechanical structures to mimic people's motion, pressing the airbag periodically. But this kind of ventilator are not equipped with biometric monitoring, which is also vital during the pandemic. Therefore, the key challenges in my research is to design an affordable and portable ventilator that have the monitoring and alarming system. So this ventilator is designed to use in two scenarios. The first is mobile cabin hospital, and the second is home age situations. In these two conditions, patients are not always contact with doctors, but in emergency condition, they can ask for help from professions. My design is mainly divided into 5 parts. The 5 modules including energy supply, gas supply, electronic control, sensors, and alarms. These 5 modules will work together and to fulfill the needs I proposed before. And there are 3 main innovations I've had. First is ECG monitoring and alarming system. By collecting the ECG data and draw the graph on computer, it allows doctor to see the current state of the patients and decide what is the treatment they should receive for the next stage. And the second is gas concentration control. It can control the amount of oxygen prompted to the patient. And the third is exotic gas disinfection. This is important because it can stop the secondary infection during the COVID-19 pandemic. This graph shows how my design will work in real time. First, the lead screw connected to stepper will press the bag valve mask, and the air will be pumped into the patient. In this way, it will connect it to an oxygen bottle, which can modify the oxygen concentration. And the patient will be connected to the sensors, including the ECG and the blood oxygen one. So these 2 sensors will send data to the Arduino controller and then to the computer. And some result will be displayed on the LCD screen. So here's the prototype I've built. It includes most of the functions I mentioned above, but it cannot reach the L filtering part now. The total cost is within $150, which is affordable for third world regions. In this research, I've developed a low-cost portable ventilation system, and it can meet most of the needs during the COVID-19 pandemic. So for the future, I will collect data from the sensors and do the analysis. I will try to design a recursive system so that the data collected by the sensors will used for the next stage of ventilation. And thanks for listening.